كان more than 200 essential diabetic fasting 110 ل 125 irritable glucose 2 hour postprandial النورمال لو كان من 140 ل 200 اذا الشخص ده عنده جلوكوز امبير توليرانس دي بنسميها بري دايابيتك. عندنا في اورال جلوكوز توليرانس تيست بنستخدمه في دايجنوز جستيشنال دايابيتس ودايجنوز بري دايابيتس ودايابيتس. اورال جلوكوز توليرانس بنقيسه في فاستنج وافتر تاور. في الفاستنج النورمال بيبقى لزان او ايكوال 100 لو كان 140 ل 199 اذا شخص بري دايابيتك. افتر 1 اور لو كان لزان 184 ده في النورمال. لو وبعد افتر 2 اور النورمال لزان 140. تايبس اوف دايابيتس عندنا تايب 1 ده بيبقى not enough insulin. تايب 2 عنده insulin resistant. تايب 1 عادة بيجي في اليونج ايج لزان 30 non obese و no family history وبيبقى عنده بوليسيستم وبيتعالج بدايت او انسولين. تايب 2 بيحصل في الاولدر more than 40 ممكن بيبقى احيانا بيبقى obese وبيوصف الفاميلي هيستوري وعندها اسيمتم في كومبليكيشن وممكن يتعالج بالاورال هايبوجلايسيميك انسولين دايت. سيبتايد ليفل سيبتايد دي بيسمعها البيتا سيل اللي بتصنع الانسولين ومستوى الليفل بتاعها دليل على الليفل بتاع الانسولين عاده بيبقوا نسبتهم متقاربه. سيبتايد ليفل عندنا تايب 1 تايب 1 ده ما بيبقاش عنده انسولين نو انسولين وبالتالي السيبتايد هتكون لو ليفل. تايب 2 عنده انسولين ريزيستنت بالتالي هيبقى السيبتايد عندها اما هاي ليفل او نورمال. ثانيه
يلا اللي بعدهم. ريكتس يلا.
Rickets is a common bone disease among the children.
مش عايز صوت يا جماعه، مش عايز صوت لو سمحتوا. الناس اللي داخله زياره دي الاخرين ايه؟ اتفضل.
Rickets is a common bone disease among the children, which is caused mainly by two major reasons. The first reason is vitamin D deficiency, which is caused by low intake in food or by malabsorption due to several diseases such as celiac disorders, kidney diseases. The symptoms of rickets are, as in the picture, are elongated and broad extremities, arms and legs, protruded chest, and obesity due to lack of movement and lack of simple motor skills. The risk factors of the rickets are dark skin and northern latitudes and premature birth and some medication and exclusive breastfeeding. The complications are the following. If the patient is left untreated, rickets can lead to failure of growth, some seizures and dental defects, and some bone deformities. The prevention of the disease is adequate sunlight exposure to activate vitamin D. Eat foods which are rich in vitamin D. Thank you.
Thank you so much. Vitamins. اكسلنت، انا مبسوط منكم عشان الالتزام بالوقت. اتفضل. يا ريت بقى نلتزم بالكلام كمان، بلاش رغي مع بعض يا اصحابي.
This is our presentation about vitamins. Main objectives, introduction, then general characters about vitamins, then general functions. First, the introduction. The word vitamins comes from the Latin word vita, means life. Vitamins are organic components in food that are needed in very small amount for growth and for maintaining good health. Everybody must eat a certain amount of vitamins to stay healthy. Vitamins are chemicals found in very small amount in many different food. Second, the characters. Vitamins are required in small quantities in diet because they can't be synthesized in the body. Water-soluble vitamins can't be stored in human tissue. Their excess is exerted with urine. Significant amounts of fat-soluble vitamins can be stored in adipose tissue and the liver. Synthetic vitamins are identical to natural vitamins.
Functions of vitamins. Vitamins are helpful for the health and life of the body in the following respects. They build up the resistance of the body against disease, prevent and cure various diseases caused by deficiency, help the digestion and utilization of mineral salts and carbohydrates in the body, stimulate and give strength to digestive and nervous system, help health protection, help maintenance of proper health and normal growth. Thanks.
اللي بعده. Viral replication. جروب الكوليرا موجودين. الكوليرا مستعدوا انتوا اللي بعدهم.
We'll talk about viral replication. Viral replication occurs during the infection process. Viral replication occurs during the infection process of the target host cell. Viral replication cannot occur outside the cell. The virus must first enter into the cell. There are two types of viruses, DNA viruses and RNA viruses. The DNA viruses assemble inside the nucleus, while the RNA viruses develop solely in the cytoplasm. There are some steps for the viral replication. First, which is the absorption, which means the attachment. Then the entry, penetration, and the uncoating, transcription, mRNA production, synthesis of the virus components, assembly, and viral release. First, we'll talk about the absorption. Infection occurs by the attachment of the variant through a capsid or envelope proteins to specific receptors of the target host cells. Example, as the poliovirus, the receptor is protein. The entry, which is the penetration. Variants can enter cells at least with three different mechanisms. First, with the endocytosis, fusion, and translocation. The uncoating. The viral capsid is removed or degraded by viral enzymes or host enzymes, releasing the viral genome.
Transcription and mRNA production. In the genome, after the encoding, transcription and translation will be initiated, maybe occurring in the host cell of the nucleus or cytoplasm. Transcription is making mRNA from DNA. For example, in the DNA, the double singlet DNA, which is converted by the DNA-dependent RNA polymerase, which translations it's making convert the many of the amino acid in the sequence of the protein from mRNA. And the synthase of the various components. The various synthase is that components in the organelles of the host cell. For example, the virus mRNA, which it is the translated of the cellular exome to making the structural units, which it is making the virus particle, or the non-structural, which it is making the enzyme using for the virus replication, the viral nucleic acid. Assembly, which it is the new mature virus, which it is encoding in the new protein code, may be occurring in cytoplasm or the nucleus. And the viral release, which it is the mature virus, it's released by the sudden rupture of the cell and making its death, which is leading the lysis, or the cutting of the virus through the cell membrane, and it is without the cell membrane. Thank you.
اللي بعدهم يا جماعه الكوليرا. مجموعة سنة تالتة فين يا جماعة؟ لو سمحتوا يا جماعة البرزنتيشنز كلها تتبعت على الايميل بتاع الستودنت افيرز. الايميل الاوفيشال SA@العيني.edu.eg اللي بيجي لكم عليه الميلاد. اللي بيجي لكم ميلاد الكلية عليه نعمل فورورد للبرزنتيشن. واحد طبعا من الجروب، مش هو كل واحد من الجروب هيخش يعمل برزنتيشن. only one presentation بس اللي تبقى
Cholera is a disease which appeared for the first time in India, so a lot of people may call it Indian cholera. It spread all over the world during the World War II, and Egypt was struck by it 3 times. After we talk about the history of cholera, let's talk about cholera in general. Cholera is a huge disease as it settles in the intestine and makes the body dry out, so it can be deadly if it left untreated. Here are some of cholera symptoms like vomiting, thirst, leg cramps, irritability, or restlessness. Researchers have found that there are about 1.3 to 4.0 million cases of cholera all around the world, and about 21,000 to 143,000 deaths due to cholera all around the world. Here are some ways to protect yourself if you are in a place where cholera is found, like beer on food, wash your hands frequently, drink bottled water or water which has been treated. And you may ask me about treatment. In most countries, doxycycline is the first line of treatment. If doxycycline is documented, there are other options like ciprofloxacin and azithromycin. Thanks.
Thank you. الجروب هو الابنورماليتيز، هم الابنورماليتيز، هو الابنورماليتيز يا دكاتره، المنظومه الابنورماليتيز اللي خلص يا جماعه وعايز يتفضل يمشي يتفضل. اللي خلص وعايز يمشي يتفضل عشان التزاحم. اللي خلص يا ولاد، اللي خلص وعايز يتفضل يتفضل.
Chromosomal mutation is a missing, extra, or irregular portion of chromosomal DNA. These can occur in the form of numerical abnormalities where there is an atypical number of chromosomes, or as structural structural abnormalities where one or more individual chromosomes are altered chromosome. Was strict sense to mean a change in a chromosomal segment involving more than one gene. Genetic disorders are disorders caused by abnormalities in more one gene or more. Some genetic disorders are hereditary or spontaneous. Hereditary disorders pass down from generation to generation, but spontaneous not passed. Occur when genetic material in the father's sperm or mother's egg cell or developing embryo is damaged by drugs or chemicals or other damaging substances. Risk factors: older age in women, a family history of genetic abnormalities, previous baby with a birth defect or miscarriage, chromosomal abnormality in one or more on one of the prospective parents. Some of the most common chromosomal abnormalities: Down syndrome, Edwards syndrome, Creutzfeldt syndrome, multifactorial inheritance, such as cleft palate or cleft lip, result from abnormalities in one or more gene, plus exposure to a certain other factor.
Types of DNA mutations and their impact. There are 4 types: inversion, deletion, duplication, translocation. Inversion involves OK syndrome and hemophilia. 40% of hemophilia cases are caused by inversion mutations. Deletions is removal of part of chromosome, and it's some examples of inversion of deletion mutation are cystic fibrosis. Duplication are present, the part of chromosomes are repeated, and it's present in some kinds of diseases. And translocation, where region of chromosome is attached to another non-homologous chromosome, and example of such translocation is leukemia. The mechanism of chromosomal mutation results from one or more coincident breaks in DNA. The deletions and duplications alter gene balance and result in abnormality. However, inversion and translocation involve no loss or gain and are normal unless a break occurs within a gene. Thank you.
في روماتويد ارترايتس هنا اتفضلوا، وبعدهم روماتيك فيبر يستعد. روماتويد ارترايتس الاول.
First of all, we will show you an overview about rheumatoid arthritis, and we will cover some site-specific symptoms. So, at first, it's an autoimmune disorder that primarily affects joints. It is common in women of middle age from 40 to 70.
Any disease has a syndrome, so rheumatoid arthritis has some syndromes, starting by painful, swelling, warm, and stiffness. And now, you can ask me about the complication of rheumatoid arthritis. It may affect other parts of the body as low and red blood cell count, inflammation around the heart and lungs, inflammation around toes of fingers. Fever and low energy may also be presented.
So, in this video, we will explain the causes and how the disease can happen. Firstly, it cures when the immune system attacks the synovium and and the colon, and the lining of membranes which is around joints. As we see, the result inflammation thicens the synovium, which can eventually destroy the cartilage and the bones of the joints. Then tendons and ligaments, which attach the joints together, weaken and stretch. So gradually, the joints lose their shapes and alignments.
After we listen to the causes of rheumatoid arthritis from my colleague, we can talk about the diagnosis. The diagnosis is made mostly on the basis of personal signs and symptoms. X-rays and laboratory testing may also support excluding other disease with similar symptoms. And now, Jasmine, tell us some medication for this disease.
Okay. Medications are steroids, pain medications, non-steroidal anti-inflammatory drug, disease-modifying anti-rheumatic drugs such as hydroxychloroquine and methotrexate. So let's ask you about the side effects of the medications. If we talk about the first one, hydroxychloroquine, although it's the best tolerated disease-modifying anti-rheumatic drug, but it may cause nausea and diarrhea. Whereas the second one, methotrexate, it may cause diarrhea, nausea, vomiting, and abnormal liver function. It may also cause mouth sores, rash, and diarrhea. Thank you.
Rheumatic fever يلا. وعندهم بيستعد Osteoporosis Hepatitis C. بيستعد بعدهم Osteoporosis Hepatitis C. اعملي ستيك كده وقولي يا ابني. الناس اللي واقفه على الباب دي يلا يا تخش يا تمشي. الناس اللي واقفه على الباب دي يا تخش يا تمشي. يلا.
Hello everyone, today we will be discussing a rheumatic fever. Rheumatic fever is a multi-organ, autoimmune, inflammatory disease affecting mostly the heart, the brain, the joints, and the skin. If not treated early, pharyngitis or scarlet fever caused by A-beta hemolytic streptococci can result in acute rheumatic fever in 2 to 4 weeks. The streptococcal antigens mimic human antigens at a molecular level, so it results in autoimmune responses. This cross-reactivity results in widespread inflammation all throughout the body, and this is termed molecular mimicry or type 2 hypersensitivity. The peak incidence of rheumatic fever is between the ages of 5 and 15. However, it is more common in developing countries due to its association with overcrowding, poor sanitation, and exposure to the bacteria. The histological picture resembles as shown bodies in the heart, which has a lot of lymphocytes, macrophages, and effusion in the organ. Diagnosis. Diagnosis of rheumatic fever follows the Jones criteria, which divides the different symptoms into major criteria, minor criteria, and all along including evidence of a recent streptococcal infection. For accurate diagnosis, 2 major criteria are met, or 1 major measure and two minor criteria are met. Always, always, always having evidence of a recent streptococcal infection, because that is the dividing line for the diagnosis. In this diagram, it sums up all of the symptoms found in rheumatic fever. The major criteria, include polyarthritis, carditis, chorea, erythema marginatum, as well as subcutaneous nodules. The minor criteria include fever, arthalgia, prolonged PR interval, or as well as increase in C-reactive proteins, ESR, and leukocytosis. The laboratory investigations required for indication of a recent streptococcal infection include anti-streptolysin-02, anti-streptokinase, as well as anti-hyaluronidase. Also, a recent a throat culture or scarlet fever would prove the infection as well. The first major criteria is polyarthritis. Arthritis affects 75% of the cases, and it is considered type 3 hypersensitivity, where there is an accumulation of immune complexes in the joint. It is a non-erosive, as well as a polyarticular type of inflammation that tends to cleat. This is really characteristic. It migrates from joint to joint. Carditis is the most severe and the long-lasting symptom of rheumatic fever. It exhibits pancreatitis, meaning it affects the 3 layers of the heart. Pericarditis resembles stitching pain in the heart, as well as pericardial rubbing sounds. Myocarditis results in heart failure, muffled heart sounds, as well as tachycardia. The defect in the valve most commonly affects the mitral valves, and it results in peritoneal murmur, as well as blood regurgitation. Okay, thank you for listening.
Osteoporosis يا جماعة. Thank you, doctor, for this very nice presentation.
I really wanted to continue, but then
Actually, it's an excellent presentation. You are an excellent presenter.
Yeah, thank you.
Thank you so much. But try to be more calm.
Huh?
Try to be more calm. Just be more calm.
Okay, next time.
اللي بعدهم يجهزوا الهيباتيتس سي.
Osteoporosis. It's more common in person aged 65 years old.
low. Secondary osteoporosis, however, can occur in person at any age. Although the loss in women begins slowly, it speeds up to around the time of menopause. Typically, it's about 50 years old.
Causes of osteoporosis. We repeatedly place demands on our bones, and because of that, our bones are constantly remodeling themselves. Bone remodeling happens in two phases. First, special bone cells called osteoblasts break down old bone. Then other cells called osteoblasts create new bone. Osteoblasts and osteoblasts can coordinate for most of our lives. However, this coordination can break down, leading to activation of osteoblasts, decrease in bone density, and eventually osteoporosis. There are also several factors contributing to osteoporosis, including high levels of parathyroid hormone, or PTH, low levels of vitamin D, low levels of calcium, abusing alcohol, smoking, and having an eating disorder. Low levels of estrogen, as it is essential for maintaining the rhythm of the bone remodeling process. Diagnosis of osteoporosis. How do we check for osteoporosis? We have plenty of tools to detect and diagnose osteoporosis, including X-rays, radiography, ultrasonography, DXA machines. A DXA machine measures the amount of bone mineral density, or BMD. A DXA machine converts your bone density information to your T-score and Z-score. Your T-score is the amount of bone you have in comparison to a normal population of younger people. Your Z-score, on the other hand, is the amount of bone you have in comparison to a normal population with the same age group. How do we treat osteoporosis? Treatment of osteoporosis includes treating and preventing bone fractures, taking medications to strengthen bones, healthy eating, including foods rich in calcium and vitamin D, making lifestyle changes such as giving up smoking and drinking alcohol, taking calcitonin hormones, monoclonal antibody drugs, and bisphosphonates, as they are shown to increase bone density and mass. Thanks, everyone.
الناس اللي داخله من غير ماسكات لو سمحت محدش يقعد من غير ماسك، معهوش ماسك يتفضل. ثلاسيميا، بعديها ثلاسيميا وبعديها بوليسيستيك اوفر.
Hi everyone, today we are talking about hepatitis C. What is hepatitis C? Hepatitis C is a liver infection caused by hepatitis C virus. It can range from a mild illness lasting a few weeks to a serious long-term illness. It is often described as acute, meaning a new infection, or chronic, meaning long-term infection. Acute hepatitis occurs within the first 6 months after someone is exposed with hepatitis C. It can be a short-term illness, but for most people it leads to chronic infection. Chronic hepatitis C can be a lifelong infection if it left untreated. Can cause serious health problems including liver damage, cirrhosis, liver cancer, and even death. Geographical distribution. Hepatitis C is found worldwide. The most affected regions are the WHO Eastern Mediterranean region and European region, with an estimated prevalence in 2015 of 2.3 and 1.5 respectively. Prevalence of HCV infection in other WHO regions varies from 0.5 to 1%, depending on the country. Hepatitis C virus infection can be concentrated in certain populations. For example, 23% of HCV infection and 33% HCV mortality is attributable to injecting drug use. How it spreads. There are many things which if people do can make them catch it, but don't panic, just be careful. And as we know, there are many things which people believe in about, but they are wrong. So let's find out. Mother-infant transmission, sharing a needle or a syringe, sharing a razor or toothbrush, kissing, hugging, or sharing eating utensils, sexual partners with HCV infection. Hepatitis risk factors. As you can see in the picture, exposure to toxic chemicals, sharing needles, unsafe drinking or washing water, unsafe sex, but not being vaccinated against viral hepatitis, and having an autoimmune disorder. It can be spread through coughing, sneezing, kissing, hugging, breastfeeding, sharing utensils or glasses, sharing food and water.
الناس اللي بتتكلم ورا دي المرة الجاية هطلعكم بره واساميكم هتتشطب من البرزنتيشن. أنا مش عايز كلام، بتتكلموا في إيه؟ الناس اللي داخلة خارجة دي. اللي عنده برزنتيشن يقعد، اللي ما عندوش برزنتيشن يتفضل.
Sharing food and water, mosquitoes or other insect bites.
So we now talking about symptoms of HCV. According to Centers of Disease Control and Prevention (CDC), up to 80% of people with hepatitis C that have no symptoms at all. Early symptoms usually occur 6 or 7 weeks after exposure to the hepatitis C virus. The symptoms we can see in the pictures, like nausea and vomiting, stomachache, pain in the joints or muscles, dysfunction of urine or intestines, yellow eyes and skin, and fever. While light symptoms take 6 months to 10 years or more before the patient develops any symptoms, until the virus damages the liver enough for the symptoms to appear, like poor appetite, bleeding and raising easily, fatigue, dark chloride in urine, fluid accumulation in the abdomen, and legs are swollen, confusion, drowsiness, and slurred speech.
ثلاسيميا. فين جروب الثلاسيميا؟ هنسأل تاني آخر مرة، فين جروب الثلاسيميا؟ مش موجودين. بوليسيستيك اوفري وراها الانسولين.
Me and my group was chosen polycystic ovary syndrome. I will give a definition to the polycystic ovary syndrome. Polycystic ovary syndrome affects 1 in 10 women that polycystic ovary syndrome affects 1 in 10 women that came in the hospital or clinic. The women that came to the hospital usually have hormonal imbalances and metabolic disturbances. when the woman came to the hospital, she suffered from some symptoms. I will give you examples for the most common symptoms of these. There are 5 most common. First thing is hirsutism, appearance of hair in different body parts. Acne is appearance of some simple things like abscess, but not contain pus, only red or small. Usually appear in males in youth age. Third thing is infertility, and infertility is the third thing, and the fourth thing is the fourth thing is irregular period. The fifth thing is depression and overweight. So I'll give you the causes of these 5 symptoms. Why does these 5 symptoms appear? So I'll discuss first the normal ovary. The normal ovary in the first day from the previous menstruation, the pituitary gland secretes LH and FSH hormone, luteinizing hormone, and follicle stimulating hormone. The follicle stimulating hormone stimulates the growth of the follicle from the first day to the 14th day. From this part, it's undergoing to the mature ovum. From the mature ovum until this, the LH hormone is secreted. The LH hormone is secreted, not important to me in the menstrual cycle, so I'll go after this. LH hormone stimulate the production of androgens. Production of androgens. Androgens is the male sex hormones. It's not important in the female, so it's always changed into estrogens. Estrogens decrease the level of FSH hormone. Why? Because its function is ended as it's from the mature ovum. Will not need the FSH hormone, never. So it decreases the production of FSH hormone. What happens in the polycystic ovary syndrome is that the pituitary gland secretes large amounts of LH hormone, luteinizing hormone. By secreting large amounts of LH hormones, stimulating the production of a lot of androgens. There are two things that result from the increased percentage of the androgens. First thing is the increase of estrogens, usual. Second thing is the appearance of male character in the female as hirsutism, as we said in the symptoms. Second thing is the acne, the simple abscess. Increasing estrogens will make a massive decrease in the production of FSH hormone. What will happen? The massive decrease in FSH hormone will not stimulate the growth of the follicle and will remain at last in the first 2 stages. If it remains in the first 2 stages, it's from a cyst. Cyst is an epithelial cell containing water. If the epithelial cell containing water and we make an ultrasound on that ovary, it will appear as this. This is the normal ovary and this is the polycystic ovary. The polycystic ovary contains a lot of cysts. While the normal ovary contains a small number of cysts, but not like the polycystic ovary. So this is one of the characteristics of the polycystic ovary, this shape. So I will summarize what I have said. I have said that the pituitary gland secretes a large amount of LH hormone, stimulate the secretion of androgens in high levels that leads to the appearance of the male character as acne and hirsutism. Increasing estrogens with a massive decrease in FSH hormone lead to 3 things: infertility and irregular periods. Third thing is the formation of cysts. That's the name of the syndrome. The name of the syndrome is polycystic ovary syndrome. That is from the formation of a lot of cysts.
Thank you so much. There is a difference between lectures and presentation. Okay? You should know the differences between lecture and presentations. And all of you should be calm during presenting a presentation. You should be calm. Not to transmit nervousness to the audience. You should be so calm. It's no shame that you read your presentation. You are not supposed to يعني مش مفروض ان انت ابدا تبقى تقعد تحفظ البرزنتيشن، مفيش حاجه اسمها كده. احنا اي حد فينا هو اللي بيعمل برزنتيشن لما بيجي يقدم بيقرا السلايدز بتاعته. واخدين بالك ولا لا؟ يعني مش مهم ان انا احفظ البرزنتيشن، لان الحفظ دايما الميمورايزيشن بتاع الحفظ بتخليني اتكلم بسرعه وخايف انسى.
وطريقه القاء ما تبقاش مظبوطه. فمش عيب ابدا ان انا اقرا من السلايدز بتاعتي، ما فيهاش اي مشكله خالص. هي البرزنتيشن مقصود بيها كده، ان انا اقرا من السلايدز بتاعتي. ارفعوا المسطات ده. ارفع المسطات. بالراحه بس عشان الناس كده تقلق. بالراحه بالراحه كده. فين الشغل ده؟ دي الداتا بتاعتك؟ الداتا دي عليها كويس. عليها كويس. لا مش لازم نلعب بعد اللي جاي بتاعه. اللي بعدها يا جماعه اللي بعدهم acute myocardial infarction. acute myocardial infarction. حتى يا جماعه دي الفلاشه بتاعت يمين وعليها عشان فلاشاتهم بايظه. acute myocardial infarction ما جوش coronary artery disease. اتفضل.
هاي همزين سجلت اسمين من واحد صار اكيوت ما كان مالي عبارة على غار قال انا مريض شنو.
يلا يا جماعه اسرع شويه. ارفع الماسك يا دكتور. يلا يا دكتور اسرع شويه. ايه فلاشه؟ ما معكوش فلاشه؟ برزنتيشن فيه مكتوب. طب يلا مين اللي بعده؟ اللي بعدهم ميركوري بويزنينج. ها؟ ميركوري بويزنينج. قول له كانسل، قول له كانسل، كانسل.
شنو موضوعكم؟ شنو موضوعكم؟ لا اسمعوني. المفروض بعد الامتحانات. عشرة على التراكم، وانت كل موديول تاخذ عليه 30 10 5. أكيد. كاظم انطي اللابتوب خليه يعرفون عني.
يا جماعه مش هنا ورا. انا مش هقول لك تاني ارفعي النار.
Good morning, doctor. Good morning, colleagues. Today we're going to talk about something called the aquagenic urticaria or water allergy. It is the more common name. These are the names. Now we have the objectives. We're going to talk about the definition, causes, symptoms, diagnosis, and treatment of this condition. The definition, well, the aquagenic urticaria is a very rare condition. It is when a person develops an allergic reaction in contact with water. It starts at the onset of puberty and it is more common in women, but it is very rare that only 100 cases have been reported in the medical literature. Now, the second thing we have are the causes. What are the causes of the aquagenic urticaria? Well, they are not known yet. Scientists and doctors have conducted many conclusions of what are the causes or what the causes may be, such as a reaction to the chemical additives in water, such as chlorine and harmful substances that may be present in water. Where these are the symptoms of the aquagenic urticaria as shown in the pictures. Now we have, they are hives. It is an allergic reaction, as we said, so we have hives on the skin. They have well-defined edges. They may be accompanied with fever, with erythema, or with inflammation. Now we're going to have the diagnosis, which my colleague Dr. Rahman is going to discuss.
To diagnose aquagenic urticaria, we have two ways. The first is physical exam. We observe the symptoms when the patient comes in the clinic. The second thing is clinical diagnosis. We perform a water challenge test. During this test, we compress the water 35 Celsius degree, apply to the upper body for 15 to 30 minutes. The upper body is chosen because other areas of the body, such as legs, are affected less commonly. Then we compare the reaction to the water challenge test to symptoms of aquagenic pruritus. Aquagenic pruritus causes itching and irritation, but doesn't cause hives or raising or lesions. It's important to tell the patient not to take any antihistaminic medications before the test. The treatment, there is no cure for aquagenic urticaria, but there are many treatments such as antihistaminic drugs, medications used to treat allergy-like symptoms, or epinephrine to help the patient breathe. And there are like topical creams like Betretin that act as skin barrier, and omnizipline injectable medication typically used for people with severe asthma. Thank you.
Coronary artery disease جاهز خلاص. Coronary artery disease. بصوا يا جماعه واحنا بنعمل برزنتيشن ما ينفعش ان حد يحط في السلايد كل الكم ده من الداتا. يعني السلايد ده المفروض الداتا اللي فيه دي تتوزع على 6 سلايدز. خلاص؟ يعني ما حدش يحط السلايد ويملاه كلام كده وخلاص. ما ينفعش. واخدين بالكم؟ ثانك يو سو ماتش.
كوروناري ارتري مش جاهز؟
كوروناري ارت ديزيز.
طيب ميركوري بايزنج جاهز ولا لسه؟
ميركوري ماشي. الاسامي مكتوبه ليه؟ تشيك بس انها مكتوبه يعني. اللي بعده يا جماعه. بليج. بليج يا جماعه موجودين ولا مش موجودين؟ اتفضل. ما ساكتين ليه يا عم؟
اضرب.
يلا يلا يا بنات. بليج يلا الفلاشه بسرعه. الفلاشه من هنا. يلا يا شباب الناس اللي واقفه ورا دي انتوا خلصتوا ولا ايه؟ يلا بعد كده لما نقول برزنتيشن تتعمل على باوربوينت مش على وورد. وورد ده مش برزنتيشن. ها؟ وورد ده مش برزنتيشن.
My topic is plague disease. I will mention the definition, type and symptom, and the reason for occurrence and the transmission method. In introduction, plague is a very serious infection disease caused by bacteria transmitted fleas when it was considered an epidemic disease. Prevalent in rural like Africa, Asia, and United States. In large way that killed millions in the past. This disease was discovered by the scientific exaggerate scene. There is other names for plague like the Great Death, the Black Death, the Black Plague. The reason of this disease is bacteria. The name of the bacteria is Yersinia pestis. It's a zoonotic bacteria commonly found in some rodents, such as flares, prions, dogs, or mice, small mammals, and their fleas. The incubation period is from 1 to 7 days. The transportation method, plague is transmitted between animals and humans through infected flea bites. Direct and unprotected contact with infected tissue. Inhalation of aerosol droplets from an infected patient. The symptom of plague patient is high body temperature, sugar, heat, and body pain, vomiting and nausea, cough with bleeding symptom, and difficult breathing. There is 2 types for plague disease. The first type is most common, bubonic streptococcus. It's most common and characterized by swollen lymph nodes. In the advanced stage of the infection, the lymph nodes can turn into open solid fluid with pus. Its trail will be penetrate to transmit from person to person. The second type is most dangerous, pneumonic plague, considered the most dangerous period. Incubation period can drop droplets flying in the air to other humans, and if not diagnosed and treated early, it might cause and lead to death. The treatment is easy, like take some antibiotics like streptomycin, gentamicin, or tetracycline. The complication of plague patient is gangrene. Sometimes it leads to death.
في حد من الدروس اللي متأخرة جاهز؟ اتفضل. البرزنتيشن بتاعتكم اسمها ايه؟ كورونا ريارتي؟ اتفضل.
ابشر البرزنتيشن.
oxygen supply and the oxygen demand. So the myocardium becomes functional. This impairs the cardiac mechanical and electrical function, and this will lead to heart failure or infarction. What causes coronary artery disease? Number one, high cholesterol. It's mainly caused by eating fatty food, not exercising enough, and being overweight. Additional causes are smoking and alcohol. Risk factors are age, family history, hypertension, and physical inactivity. Symptoms. What does the patient feel when coronary artery disease occurs? Number one is angina and chest pain. And this radiates to the back, to the neck, to the jaw and shoulders, and arms, especially the left arm. In addition to that, you feel in weakness and shortness of breath. This will be accompanied by rapid heart beats and no sensation and sweating. How can we diagnose coronary artery disease? There are many ways, but I have just put